Hi, my name is Laurel Valentino. I'm the Director for Neurosciences at Spine Care Center at Methodist Hospitals in Maryville and Gary, Indiana. I get to present today on our marketing program for our Spine Center. And I am grateful for that opportunity to share some of the things that we've done within our Spine Center. It is always nice to be able to share with others and to learn from other people about how we can best take care of our patients. So we'll go ahead and get started. Oh, sorry. Our branding for our hospital at Methodist is leading the way to a better health. The audience that we have chosen to really target our marketing to is, first of all, to the general public. And the reason we did that was because we knew basically we would get people who would self-refer that might have been through many different physicians already. But knowing that, we went ahead because the general public can make those decisions, and they are looking for information continuously. So if we didn't get them in through the Spine Center, we were able to get them to the right PCP within our system or even to our pain management. So our target, first of all, has been that general public, our physicians. Our employees is another group that we have been working with to streamline their care, especially through our employee health, getting them into the right doctors for the right time. Our emergency room also, that staff we've been working with to give them information on back pain, and the goal there is to get the patients seen in the emergency room, taking care of their emergent problems, and get them home and give them an opportunity to call into the Spine Care Center, that we can get them fast-tracked into the physicians that they need to see. Instead of being admitted through the emergency room and having overnight stays, we can streamline their care to the right doctors. And the other thing that we're trying to do now is to hit up and talk with some of our insurance providers. That is more of a long-term goal, but what we've found is that our insurance liaisons and the case managers that are working with people who have chronic back pain have been very complimentary of our priority consult system, because what they're finding is that they can call us. There's one stop, they call one person, and they can get the patient in to be seen at the right time for the right doctor. So our current marketing strategy basically is direct marketing to those patients and especially our primary caregivers. We start with our top referring physicians. We look at what's going on in their offices and what they need, including supplying them with all of our patient education material and our reference sheets so that they can easily contact us, hand the piece of paper to the patients, and get them to call in to the priority consult number, and then that way we can start taking care of what their needs are. Office staff are key to marketing because they're the ones who usually will be the ones who can hand it to the patient and say, yes, we find this service has been very good for us. Why don't you call and try it? We actually just did a office staff appreciation day, and it turned out very positive. They really do like the idea of having one phone number and one person that they're used to calling for any of their patients, especially the chronicity of those patients. Our success stories is another thing that we've been trying to promote. Our newspapers in this area are very positive about picking up patient success stories and making sure that those stories are well spread out. As a matter of fact, our last story was picked up by both of our local newspapers. So positive stories in healthcare is a definite need. Our tactics basically that we've been using is mainly community education. We want to make sure that our website is up and running and all of our patient education is on there. We do have a few videos now available for patients so they can see what types of surgeries that they might have already scheduled, like anterior cervical fusions or kyphoplasties or whatever it is. We can refer them to the website. But we also do a lot of community lectures, health fairs, our open houses, and reaching out to the YMCA. We find that we can work directly with the patients who are having issues and then we get their questions answered. It's also seen as a positive because we are trying to prevent them from having issues and trying to give them good health ideas so that they can stay more healthy instead of just saying, okay, we're going to go and do surgery or we're going to take care of your issue and then turn you over to nobody or nothing. It's more of a comprehensive system where we can make sure that we encourage them to be encourage their health instead of just fixing one problem. We also use our spine care centers has Billboards and our HealthWise. HealthWise is our newspaper ads that we put into quarterly into the local newspapers, and we'll show that in a minute. This is one of our billboards that we just had out. We do use our surgeons, our nurse practitioner, and our intake coordinator. We want to make sure that we put the names and faces to the people that are taking care of our patients. And again, we do utilize the logo, the leading the way to better health. Another one of our flyers, these are the flyers that we actually put out in each of our offices, our physician offices. And as you can see, we advertise our free back and neck pain seminars. Those are put on by our nurse practitioner as well as our physicians. All of our doctors are very active in providing in-services for the patients, and they will go to any of our outreaches. It gives them hands-on. Patients get to see who the doctors are or who the nurse practitioner is, and they really do like that contact. They're very willing to answer questions for them, and we do advertise it throughout our community. Our patient stories, as I said earlier, our newspapers love our success stories. With all the negative influences happening in healthcare right now, with all the changes in insurances and coverage, having success stories really gives it a positive, and people are kind of drawn to those stories. New technologies also, we want to make sure that our area knows that we have the best technologies. We are right up there with things that are happening in Chicago, or our other competition is Indianapolis. We have rack cards for each of our doctors, and the cards simply say what the doctor's philosophy in care is. And for like Dr. Shepard, he makes it well known over and over that 80% of the patients who have back pain do not need surgery. So it's not just about doing surgery, it's about taking care of that patient. The Indiana Business is a newspaper, a magazine that really does promote businesses within the state of Indiana. And we were featured in that because of our priority consult model that we use. It shows that we are being economical with our patients. We are getting them to the right doctor at the right times for the right reasons. And that's the message that we try to promote in each of our stories and each of the articles that we have. So we want to make sure that we're monitoring also our patient outcomes and showing that we do have good outcomes. Priority Consult helps with that, so we can pull data from that to show that, yes, patients are doing better. Education is another component that we try to make sure we use as our marketing. Our physician and nurses, we do have a spine conference yearly. It is actually coming up pretty soon, and our surgeons and our nurse practitioner will present there. We usually have around 125 people that attend to that, so it is a very good outreach so that they know that services are available. We provide CME luncheons for CME and CNEs for the nursing staff also. Our community outreach programs, the YMCA has done a very good outreach for us. Patients are there already in the YMCA. They're there for workout, and they're working out, trying to be healthy. So what we have now is we do our osteoporosis clinics, our back pain clinic, and we have a physician who's a sports medicine physician once a week out at the YMCA's. And it basically, they provide free information, free seminars, as well as they can actually see a physician if they have issues right there at the YMCA. The health fairs, again, also are every one of our health fairs. We do screenings. Our screenings that we really try to zero in on are for the kids and for scoliosis. We try to make sure that, especially around the beginning of the year, we do screenings with the kids with the backpacks. We can see how they're walking and the heaviness of those backpacks on the kids and the effect that it is having on their spine. We try to get them, as well as their parents, to understand that spine care is important for everyone, not just older people, but it starts at a young age, and we need to keep our spines healthy. The key message that we do try to keep and everything also is that it's always about the patient. This is a patient experience. We want to make sure that we guide the patient as quickly and promptly as possible. So we have the one-call number. We have the intake coordinator who gets that telephone history and the current status of the patient. We make sure that we keep track of our patients. Right now, through Priority Counsel, any patient that is being seen and does have surgery, we are following out for 2 years to see what kind of outcomes they have. And that's very important because our insurance companies and our payer sources right now are looking at what kind of outcomes surgery does have and what happens with the patients if they don't have surgery. We are monitoring non-surgical patients for 1 year. And all of those calls are through our nurse practitioner. Our nurse navigator is our nurse practitioner, so she fills in 2 roles, which is she is also our coordinator for osteoporosis clinics. We do make sure that our education to our patient is comprehensive. Not only do we do pre-op education, we do post-op education, and now we have just added into our educational process the discharge planning. So our patients actually get a full education before they have any type of surgery, and we get them ready for the whole procedure. The key message that we're trying to get to our physicians is that this is a multidisciplinary approach. Spine care is not just a spine surgeon. It is a combination. So we do have our spine surgeon who's a specialist. We have neurosurgery support, pain management. We have PCPs who are also involved in our care. And we want to make sure that we get a rapid return for this patient. We also want to make sure that any of the physicians that we work with, that they understand that we are coordinating care with them. We are not taking over on the patient. So we prioritize these appointments. We get the information. We follow up with the patient's test results are for that first appointment. And then we make sure that we hand back the patient to the PCP if there is no surgical treatment needed. And then, or we coordinate with them what the recommendations are. It might be pain management, physical therapy, or any other interventions that are possible. But again, it's the idea that it's a multidisciplinary approach. Our nurse care coordinator, who is in charge of our priority consult, she maintains communications with the patient as well as that referring physician to make sure that we are meeting the needs for both sides. We also make sure they know that we do have dedicated units. We have neurointensive care, neurointermediate care. We have certified neuroscience nurses and the state-of-the-art equipment. And our OR suite is specific for our spine conditions. They also know that we have community education classes, and we want to make sure that everyone does know that we can do these classes if they have groups that they want us to do them in their office for. We are available to meet with them at any time. For our patients, we make sure that our spine care center and our referral base lets them know that we will take care of them even if they don't have a doctor. We will help them find one. If they don't need a surgeon, we will get them in contact with a PCP or actually pain management if that's what they need. So we try to make sure that we offer the right benefit for the patient, and we try to do it as rapidly as possible. We do let them know that our turnover time is usually within 2 weeks. If there is something that needs to be done quicker, we can get them into an office to see a physician within 24 to 48 hours. Okay. So basically the first thing is that they do contact through our priority consult our staff, and we get that medical history. After that, we make sure we have the films. Nowadays, with the idea of computers and with our updates, we can get the electronic versions of the films much faster. So it doesn't take quite as long anymore. We still use that 2-week time frame, but we can get most of our films within a day or two, and at times we've gotten them on the same day. We also make sure that our patients realize that this first call to priority counsel and the screenings that we do, there is no out-of-pocket expense for them. They may have to pay for, or depending on their insurance, for tests that might be needed, but they would have that expense anyway. But we are saving them that first office visit because we are doing it through the priority counsel. This slide is not too good, but I will point out that, again, that we try to get our newspapers to pick up on stories, and they love to have the stories that especially are for new equipment as well as for patient stories. We put out our notices, and we try to make sure that we have these updated so they can be picked up by any of the newspapers, or like we have Indiana, northwestindiana.com, and it will have the little blurbs out there. And again, trying to make sure that everyone understands that our priority consult was developed because 80% of the spine patients truly don't go to surgery or don't need intervention, but they do need care and they need medical assistance, so we get them to the right places so that they can have the right evaluation that they need. This is our new Ortho Spine Center. It will open the beginning of the year. We're very proud of it, and because of our system, as systems has been growing, we are coordinating more with our orthopedic area and bringing up our spine center. Our marketing for our hospital brand, again, is leading the way to better health, and we do have a website which we can direct our patients to. That site does hold all of our information on our spine care centers. Our marketing material has that same kind of branding. We do want to make sure that we put in here each time a general phone number, and you can see that there's a 188 number on here, docs. That number really gets us all of our data for how our marketing materials are working. We centralize those phone calls so that we can tie in, and we have a way to monitor how much a return on our marketing material gets dollar-wise. So we know if those patients, we can track them in our system then, if they come in for surgery, if they come in for medical care, if they're here just for tests. So we can actually put a dollar amount on that. That is a number that we use for all of our services, so it's not just limited to spine, but we can aggregate out all of that data so we know when and how our patients are coming in and our return on our investment, which has definitely been positive, and so far it has been a huge help for us to market our priority consult, that one-stop kind of shop, because it's been positive not only with patients but also with our payers. Again, some of our marketing material moving forward and making a difference. We have more doctors joining our practice every day. They have also been on board with our system of incorporating our spine care. So we have our orthopedic doctors, our spine doctors, and our sports medicine doctors all joining in with our surgeons and our general practitioners, trying to make this system work, and it has been very positive. Our osteoporosis outreach, again, also is with our spine surgeon. He has made it his point to really outreach to patients to let them know that we can have healthy spines. We can prevent injuries from happening by trying to change how we eat, exercise, especially vitamin D levels, which he pushes quite often, and trying to collaborate with the PCPs to make sure that we provide good health for our patients. Our health-wise issue this last winter was, again, Dr. Shepard with our new GPS, our Stryker services. We also make sure that each quarter when our HealthWise goes out that we have something in there about spine and our new specialty units. Anything and everything that we can do related to spine, not only surgical, but we do medical. We put in our outreach to physical therapy and our PNMR doctors so that we can continue that idea that it's not just about surgery, but we want to make sure we do what's needed for that back pain patient and get them on board with it too. How do we measure our success? Is mainly through the number of OR cases, the number of outpatient tests that we have. We do measure the dollar amount through our barrel registration, which keeps track of our patients throughout the hospital. And we do ask our patients, how did you hear about us? And many a times through our advertisement, we can pinpoint exactly where they have through that Barrel Institute, because our Barrel registration tracks it, as well as through our priority consult. We always ask also, where did you hear about us from the Spine Center? And a lot of our referrals come through our health fairs that we have and through the education. At each of the education seminars that we have a sheet of paper. It's just a very simple format that says, if you have back pain, this is what you can do, and call this number, and it is our direct number to priority consult. Again, our leading the way to better health is our marketing strategy. We also try to make sure that we collaborate with each and every different services within Methodist Hospital so that we can complement our services. By doing that, we can make appropriate referrals so that each person and every person that comes through our lines can be seen and treated appropriately. So it is a very collaborative effort in every way. And thank you for attending, and I hope this has been beneficial. And if you have any questions, please feel free to give me a call through the priority consult. Thank you.